I'm Dan Liu. I'm going to perform the lab application for final exam. First, scan my room entirely. Okay. My first name is Dan, last name is Liu, and now I perform the hand hygiene with alcohol gel. Wipe my stethoscope. Then wear my gloves on. Okay, so can I check your ID band, please? Thank you. Your name is Alice, your date of birth, your age, all the information matches. Now let's start. Hi, my name is Dan Liu. I'm gonna do the physical assessment for you today. Is that okay? Thank you. Do you want to go to washroom? No. Do you feel comfortable? Yes. So I draw the curtain, make some private room for you. Now let's start with the general survey. First, your physical appearance. You appear to be your stated age. Your skin color is consistent with your genetic background, and there's no outdoors. Please stand up and sit down. Thank you. Your height is within the normal range for your age and your gender. Both sides are symmetrical. There's no obvious physical deformities. Your body contour is good. Now for your behavior, your facial expression is appropriate for this situation, and your speech is clear, fluent, and understandable. Your personal hygiene is good, your clothes is clean, and you are groomed. Also, you are able to make eye contact with me. Now for your mobility, please stand up and walk across to the room. Okay, so your gait is well balanced, smooth with symmetrical arm swing, and your range of motion is well balanced, and your range of motion is coordinated and smooth. Alright, for your work of breathing, please inhale and exhale. Okay, your breathing is unlabored, effortless, and noiseless. There is no signs of distress. For your level of consciousness, you are awake and alert. Do you know what's her name? Okay. Do you know where you are? Okay. Do you know what's the season now? Okay. So the patient know everything. Now let's move on to the head. First, your skull size is within the normal range. Both sides are symmetrical. Let me palpate. Do you feel tenderness? So no tenderness, no lumps, no swelling. Okay. For your hair is black, is even distributed. There is no baldness. You have good quantity of your hair. Now for your facial structure. Facial structure is symmetrical, and there is no scars, no lesions. Please let me palpate. Do you feel tenderness? So no tenderness, no swelling. Okay. Now I'm gonna check your cranial nerve number 7, which is facial. Okay, please follow my instruction. Smile, show your teeth, make a frown, lift your eyebrow, and close your eye tightly, and make a puff your cheeks. Okay, so all your motions are symmetrical, and your cranial nerve number 7 is intact. Now let's move on to the eyes. First, your eyebrows and your eyelids are symmetrical. Please close your eye. Okay. Please close your eye. Open your eye. Okay. So I can see there's no lid lag, and your eyelashes are even distributed. There's no crusting, no discharge on the eye. The sclera is white in color, which is normal. Now I'm gonna check your cranial nerve number 3, the oculomotor nerve. First, check the pupil size. The right side is 5 millimeters. The left side is 5 millimeters also. So both sides, the pupil size are equal and symmetrical. Both pupils are rounded in shape. And now I'm gonna check the direct and the consensual light reflex. Direct light reflex means when I use the pen light and shine the light to one eye, the pupils will become constricted. The consensual light reflex means when I shine a light to one eye, the pupil of the other eye also will be constricted. Now, I'm shine a light from side to middle, Okay, so I can see both direct and consensual light reflex are happened on my patient. Now check your pupil accommodation. First, stare at the tips of the pen light. Okay, so I can see both pupils are dilated. I move closer. Okay, so both sides, both pupils are constricted and the eyes converge. Okay, the cranial nerve number 3 is intact. Now let's move on to the ear. First, both ears are symmetrical. There is no discharge. Please let me palpate the auricle and tragus. Do you feel tenderness? No tenderness. Let me do the whisper test. I will put one finger in your opposite ear and say 3 words to you. So please repeat the word to red apple so the patient can hear the whispered words and she doesn't have hearing loss. Now let's move on to nose. Nose is on the midline. There is no crusting, no discharge. And let me palpate the frontal sinuses and the maxillary sinuses. Okay, do you feel tenderness? No tenderness, only feel the mild pressure. Now let's move on to the mouth. The lips are symmetrical, pink in color, there's no swelling. Now I'm going to use the tongue depressor and pen light to check inside. Please open your mouth. Okay, your gums are pink in color. There is no bleeding, no swelling. And also your teeth, all your teeth are intact, present, and there's no looseness. Your tongue is symmetrical and pink in color. Lift your tongue, please. Okay, so the base of the tongue is hydrated and there's no lesions. The hard and soft palate are intact and there's no lesions. Also, now I'm gonna check your cranial nerve number 9 and number 10, which are glossopharyngeal nerve and the vagus nerve. First, say ah. Okay, so I can see the uvula and the soft palate are moved up and back, which means cranial nerve number 9 and number 10 are intact. Now let's check cranial nerve number 12, the hypoglossal. Please stick out your tongue. The tongue is on the midline. Please move your tongue from side to side. Okay, so the patient can do this. Please say light, tight, dynamite. Okay, so the patient can say light, tight, dynamite without any tremors. The cranial nerve number 12 is intact. Now let's move on to the neck. First, the color is consistent with the other part of the body. There is no scars, no lesions, no visible masses. Please let me palpate. Do you feel tenderness? No tenderness, only feel no tenderness, no obvious enlargement of thyroid. Now I'm gonna palpate your carotid arteries. For one side, the rhythm is regular, the grade strength is +2. For another side, the rhythm is regular, the grade strength is +2 also. Now I'm gonna check your cranial nerve number 11, which is the spinal accessory. Okay, I'm gonna apply some resistance on you. Please turn your head to left, turn your head to right. Okay, so shrug your shoulders. Okay, the patient can resist the resistance, and the cranial nerve number 11 is intact. Now let's move on to the upper extremities. First, the color is consistent with the other part of the body. There is no deformities, no scars, no lesions. Now let me palpate. Do you feel any tenderness? So no tenderness, temperature is warm to touch, no swelling, and no masses. Okay, now show me your nails. Okay, nail beds are pink in color, nails are rounded, there are no lesion. Okay, so please stand up, do some range of motion with me. Flex your finger, extend, flex your wrist, extend, radial deviation, outer deviation. Okay, flex your elbow, extend, supination, pronation. Okay, shrug your shoulders, abduction, adduction, internal rotation, external rotation. Thank you. You can sit down. Do you feel any pain? So no pain, no altered range of motion, no cracked teeth. All right, I'm gonna check your radial pulse here. So I'm gonna palpate both sides at the same time for 1 minute. Okay, so the rate is 90 beats per minute. The rhythm is regular. The grade strength is +2. Both sides are equal bilaterally. Now check your hand grip strength. Please squeeze my finger quickly. Okay, another hand. Okay, so the patient grip strengths are are strong on both hands. Both sides are symmetrical bilaterally. Now let's move on to the lower extremities. First, I'm gonna check the color. The color is consistent with the other part of the body. Both sides are symmetrical. There's no scars, no lesions. Now I'm gonna palpate. The temperature is warm to touch. Do you feel any pain? No tenderness, and also no swelling, no masses. I'm gonna palpate both of your dorsalis pedis paws here. Okay, so I check both sides. The rhythm are regular. The grade strength is +1, which is not strong. Now I'm gonna check your posterior tibialis pulse. So here. Okay, so I palpate for both sides. The grade strength is +2. The rhythm is regular. Both sides are equal bilaterally. Now I'm gonna check your dorsiflexion and plantar flexion. So please do dorsiflexion and move your feet up. I'm gonna apply some resistance on you. Okay, perfect. So you are able to resist the resistance on both sides. And the grade strengths are strong and equal bilaterally. Now I'm gonna do plantar flexion on you. I will give you some resistance. Okay, so you are able to resist the resistance on both sides. The strengths are strong and equal bilaterally. Now I'm gonna take my gloves, perform hand hygiene, and change a new glove. Okay, so now let's move on to the thorax. First, please turn around and lift your shirt so that I can see your posterior thorax. First, the color is consistent with the other part of the body. Both sides are symmetrical. There is no scars and no skeletal deformities. Now I'm gonna palpate. Do you feel tenderness? So no tenderness, no tenderness. The temperature is warm to touch, and also there is no lesions and no swellings. Okay, now I'm gonna access your breath sound. Is that okay with you? Thank you. So please follow my instruction. Breathe deeply, slowly by mouth. Inhale, exhale. 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 Thank you. So you can let your shirt down. There is no wheezing, no crackling on both sides. Both sides are equal bilaterally. Your lungs are clear. Now you can turn back so I can access your anterior thorax. Alright, in last 1 minute, I checked the respiratory rate for my patient. The rate is 15 breaths per minute. Rhythm is regular. The quality is effortless, unlabored, and noiseless. Now I'm gonna check your heart sound. Okay, so please lift your shirt. Now I'm gonna start with the right sternum border and the second intercostal space, which is aortic valve. Then I move on to the pulmonic valve, which is at the left sternum border and the second intercostal space. Okay, then I move on to the left sternum border and the third intercostal space, which is Erb's point. Then I move on to the left sternum border and the fifth intercostal space, which is the tricuspid valve. Then I move on to the fifth intercostal space and at the left mid-clavicular line, which is the mitral valve. Okay, so at here, I can hear the best S1 sound at the apex of the heart, which is near to the mitral valve and the tricuspid valve. Then I can hear the best S2 sound here at the base of the heart, which is near to the pulmonic valve and aortic valve. Alright, then I'm gonna go back to the mitral valve to access the apical pulse for 1 minute. Okay, so the rate is 90 90 beats per minute. The rhythm is regular, and also there is no extra here, no extra hard sound. Okay, you can let your shirt down. Please lie down on the bed, and I'm gonna drip you and check your abdomen. Okay, so first the color is consistent with the other part of the body. The structure is symmetrical, and there's no lesions, no scars, no edema, no obvious veins. Now let me auscultate the bow sound. For the bow sound, first let me start with the right lower quadrants. Okay, right upper quadrants. Okay, left upper quadrants. Okay, left lower quadrants. Okay, so the bow sounds, I can hear both sounds are hyperactive in all 4 quadrants. I can hear a gurgling sound in all 4 quadrants. The frequency is 15 times per minute. And now I'm gonna palpate. I will do light palpation. Start with the right lower quadrants. Do you feel tenderness? No tenderness, no superficial masses. Move on to the right upper quadrants. Do you feel tenderness? So no tenderness, no superficial masses. Move on to the left upper quadrants. Do you feel tenderness? So no tenderness, no superficial masses. Let's move on to the lower left quadrants. Do you feel tenderness? So no tenderness, no superficial quadrants. Now I'm gonna move on to the palpate your bladder. It's down here. Okay, do you feel pain or discomfort? So no pain, no tenderness, no discomfort, and there's no distension. Now I'm done with the head to toe assessment. You can dress up, and I'm done. Thank you.